A lot of students misunderstand an MI, so I'm going to make it super easy for you in less than 3 minutes. Stick around to the end. All right, so an MI is a myocardial infarction. Myo means muscle, cardial means heart, infarction means it's not getting oxygen. So the heart muscle is not getting oxygen. All right, how'd that happen? Well, look at these beautiful blood vessels. That's how they started out when we was born, okay? And then we started having a high fat and a high sugar diet and sitting around and not doing anything and smoking and got our hypertension. And then all this cholesterol and fat and junk started building up in all of our vessels. That is called atherosclerosis. The vessels kind of start to look like this. They got sludge up in there. Now, in order to push blood through, you have to push it kind of hard to get it through this nastiness right here. So that's going to give them a little bit of the hypertension. So now we're pushing hard at the sludge inside your vessels, all right? Now, when your body realizes there's something sludgy in there that's not supposed to be there, it's like, something is wrong, and it sends out a whole bunch of platelets, and it's like, don't worry, I'm going to stick together around whatever the crap this sludge is, and I'm going to make sure that it doesn't hurt you. But uh-oh, it did, because now the platelets and the sludge are completely blocking the blood vessels to the heart. This is what causes angina, which is chest pain. Yeah, it's going to hurt when no blood flow can get through and your cells start to die from lack of oxygen. That hurts. So they're going to start experiencing episodes of angina or chest pain. All right. So that is going to eventually lead to the point where we get so much sludge and junk up in here that they're going to end up having a full out myocardial infarction, which means the heart muscle is not getting blood flow because of all the sludge. It's blocked the blood flow. Okay. Now, all of this is happening in the coronary arteries. This is where students misunderstand. They think this is happening inside the heart. No, girl, okay? This is in your coronary arteries on the outside of the heart. These are the coronary arteries that provide oxygen to the heart muscle. So if these are filled with this and this, then they are not going to be giving blood flow and oxygen to the heart muscle, and the heart muscle is going to start to die. It doesn't pump very well, and it starts to die. Then the patient's like, oh my God, my chest hurts and I can't breathe and my left arm's all crazy. Okay, this is going to lead to poor perfusion because these are filled with sludge. Heart muscle's starting to die. Heart's not pumping very well. Patient's not feeling very well, right? And so they're going to get poor perfusion. That's what gives us the signs and symptoms of our typical MI, because the patient's heart not pumping well because the heart muscle is actively dying.